Over the past decade, the cost of health insurance for small businesses has spiraled upwards by 123%. As a result, the percentage of small businesses offering coverage dropped from 68% to 59%. Recently, the New York Times ran a front-page article reporting that premium increases for small businesses next year would average 15% increase. In some states, health insurance companies plan to jack up increases by as much as 20 to 35%. This is intolerable and it's unsustainable.
Small business owners like Mark Lane of New Hampshire know this all too well. Mark testified before my committee in March just 2 years ago. He offered his employees full health care, as many businesses did. In February, however, in the midst of this recession, his insurance provider increased his premium by 45%. It jumped from $179,000 a year to $260,000 a year for a weaker plan that required his employees to pay a major share of the premium. This is just not right, and it is unsustainable for the millions of small businesses in the same situation.
Every day that goes by is a day where our small businesses are crushed under the weight of health care costs that they can't control.
We are part of that group that has fallen through the cracks. We are the educated Americans, many of us are, who are trying to work and provide jobs for this community that we live in. Yes. But it becomes more and more difficult each and every year to make decisions on whether or not we can provide health care or whether or not we have to cut jobs.
Cost is a big problem for us, but it's not the only problem. We've had serious problems with insurance companies. Since we switched to individual plans, one of my employees had been denied coverage because her son had juvenile diabetes. The insurance company ruled it a pre-existing condition.
Everybody here wants to, or even still does, even though the costs are high, provides insurance for their employees. But we need to do more of that, but we need affordable coverage that you can only get with comprehensive health care reform.
Under our present health care system, small business owners and the self-employed are at the end of the rope. Yeah, that's right. They're sort of at the bottom of the food chain, if you'll have it that way. They get whipsawed around all the time because they have no bargaining power whatsoever. I can tell you that under the bills that we have before us, here in the Senate and in the House, I've said many times, the biggest winners under this health reform movement that we have in the House and the Senate will be small businesses and the self-employed. They will be the big winners. Currently, small businesses pay up to 18% more per worker for the same health coverage that a large business pays. Our legislation will create health insurance exchanges to increase competition, enable small businesses to easily compare prices, benefits, and quality of health plans. In other words, transparency. Our legislation will put a stop to the discriminatory insurance industry practice of jacking up premiums for small businesses by as much as 200% when an employee gets sick. Our bill would end the practice of denying coverage based on pre-existing conditions or increasing premiums based on health status, gender, or by industry. Under our legislation, an estimated 3.6 million small businesses nationwide will qualify for a tax credit, not deduction, tax credit of up to 50% of the premiums in order to make coverage more affordable.